Hey guys, what's up? This is Dr. Gonzalez from Primary Anatomy. So a few weeks ago, you voted on my YouTube channel community where I asked you, where I wasn't able to decide what anatomy video to do next. And so from the votes that I got, most of you voted that you wanted me to go over the female menstrual cycle. So that's what I'm going to do today. So let's get started. What I'm going to do today, I'm going to go over a PowerPoint presentation that I have. This is using the principles of anatomy. Before I get started on the actual cycle, I just want to give you a brief reminder or overview of the female reproductive system. And so remember, in this picture, what you're looking at is the sagittal section of the female reproductive system. This is the anterior view, and this is the posterior side or part. This right here is what we call the mons pubis of the female. Inside of the mons pubis, or inside the skin, you're going to find fatty tissue. This is the pubic symphysis. And then if you observe externally, there's a couple of structures that are important, such as the structure, it's the clitoris or the erectile tissue. This is the labium majoris or majus, and this is the labium minoris or minus. This right here is the urethra with the external urethral orifice, and that leads to the area where you will find the urinary bladder. And notice that posterior to the urinary bladder, you will find the vagina or vaginal canal. And then adjacent to the vagina, there's going to be the uterus. In this area where they intersect, this is where you will have the posterior fornix and the anterior fornix of the vagina. And this is what we call the cervix. Attached to the uterus, you're also going to find the uterine tubes or fallopian tubes with the fimbria close to the ovaries. And remember, this is only half of it, but remember there's two of them. And then posterior, back to the area of the vaginal canal, posterior to the vaginal canal, it's where the rectum is located. And then posterior to that, you will find the area of the coccyx and the sacrum, right? These bones right here. And now I'm going to make a quick stop, because if you are liking this video, I want you to go ahead and give us a thumbs up on this video and subscribe and share this video with as many people as you want. And if you're already a subscriber, thank you so much for your support. I really appreciate it. And now let's continue with our video. So here is the female reproductive cycle. Let's begin with that. And here's a couple of things that are very important to remember. So first of all, non-pregnant females experience cyclical changes in the ovaries and the uterus, and each cycle takes approximately 1 month. But this is in average. Some females can take a little bit longer and some females a little bit less, right? In average, it's 28 days. Some females can go up to 40 days. Some females can go as little as 22 days. And that is still very normal. However, continuing with this information says the cycle involves oogenesis and a preparation by the uterus to receive the fertilized ovum. The ovarian cycle also includes changes that occur during and after maturation of the oocyte. Oocyte is the same as the egg, remember that. And the uterine cycle involves changes in the endometrium, which is that inner lining of the uterus, that prepare it for implantation of the developing embryo. And gonadotropin releasing hormone, or for short GnRH, from the hypothalamus controls both the ovarian and uterine cycles. So we're going to start here at the area of the brain, particularly with the hypothalamus and the pituitary. Particularly from the hypothalamus, notice that we are releasing GnRH. And GnRH, it's going to stimulate the release of FSH and LH from the anterior pituitary. So if you notice, FSH, remember, stands for follicle stimulating hormone, and LH stands for luteinizing hormone. So FSH if it once it's released from the anterior pituitary, it goes into your bloodstream, and from the bloodstream down to the female reproductive system. So FSH is going to stimulate the growing follicles inside the ovaries for initial development of the ovarian follicles, and it also stimulates the ovaries for further development of the ovarian follicles and the secretion of estrogen and inhibin. Meanwhile, LH, or luteinizing hormone, stimulates ovulation in particular, and it also stimulates the corpus luteum. If you recall, the corpus luteum is the structure that develops right after ovulation, because this follicle remains inside of the ovary, and it becomes the corpus luteum. And so the corpus luteum, what's going to do is going to secrete progesterone, estrogens, relaxin, and inhibin. In the case of inhibin, right, the reason that females release inhibin, it inhibits the release of FSH, and to a lesser extent, it also could inhibit LH. So that's why you would see these dash arrows, right, to inhibit it. The other hormone, it's called relaxin. And the good thing about these hormones is that they also have a name that could relate to what they are doing, their functions. So relaxin inhibits the contractions of the uterine smooth muscle. And during labor, it increases the flexibility of the pubic symphysis and dilates the uterine cervix. In the case of progesterone and estrogen, these are the two most common known hormones that are produced by the female reproductive system. So progesterone works with estrogens to prepare the endometrium for implantation. Remember, endometrium is the inner lining of the uterus. And it also prepares the mammary glands to secrete milk, and it inhibits the release of GnRH. Remember, GnRH is that hormone that comes from the hypothalamus, and LH that comes from the anterior pituitary. And then lastly, estrogens, right? Estrogens promote the development and maintenance of the female reproductive structures, the feminine secondary sex characteristics, and the breasts, as well as it increases the protein anabolism, lower blood cholesterol, and it moderates levels or inhibits, inhibits the release of GnRH, FSH, and LH. The female reproductive cycle has several phases. Like I said before, it can go from 22 to 40 days. In this picture that you're looking at here from this presentation says from 24 to 36 days. So there are some variations there. However, it is going to be divided into 4 phases. There's a menstrual phase, pre-ovulatory phase, ovulation phase, and post-ovulatory phase. And in this graph, this is one of the best graphs showing you what's happening within the female reproductive cycle. So we have here a couple of things to observe. First of all, notice at the top of this graph, you can see the brain's glands such as the hypothalamus and the pituitary. Specifically, we're considering the anterior pituitary. And remember again, those hormones, GnRH, FSH, and LH. The second thing that you most observe is here the ovarian cycle. So this part of the graph, it's going over the ovarian cycle per se. So the changes that happen inside of the ovaries. And then another thing that you have to consider for the female reproductive cycle is the uterine lining or the uterine cycle, right? So this part of the graph, it's going over the changes that happen within the uterus. First thing that you have to notice here at the bottom is the days, right? Like I said, in general or in average, females have 28 days of cycle. So notice that we go from day 1 to day 28. And notice that we have those phases that we just mentioned, the menstrual phase, pre-ovulatory phase, ovulation, and post-ovulatory phase. Right? And notice we have the stratum functionalis and the stratum basalis. The stratum basalis is the one that remains intact inside of the uterus, and the stratum functionalis is the one that's going to be shredded every single month after this cycle ends. Right? So we're going to start here on day number 1. Day number 1 is the first day of the menstruation in females. Right? So that's when you start counting in your calendar. Your first day of your menstruation is the first day that you will count on the calendar. And so typically the menstrual phase goes from 5 days to 7 days. Some females can last up to 10 days. But in this example, we have 4 days of a menstrual phase, 4 to 5 days. Right. So notice that as the female is going through the menstruation phase or menstrual phase, the stratum functionalis gets shredded, right, down to it's closer to the stratum basalis. And at the same time, we have several hormones like FSH stimulating those primordial follicles, right, for them to continue developing the egg inside of the ovaries. So notice that those primordial follicles start growing into primary follicles, secondary follicles, etc. And so the egg continues to be nurtured during those stages. After that, females go into that pre-ovulatory phase, which goes approximately from day 5 or 6 up to day 13. In this case, you can see here the proliferative phase. And what's happening is now the stratum functionalis of that uterus starts to grow again. So you see an increase on that lining of the uterus. And at the same time, there's going to be a stimulus by estrogen. So there's going to be a little bit of an increase of estrogen in blood because it's stimulating the uterine cycle. At this time, notice that LH starts to stimulate the ovaries, right? And notice that the secondary follicle continues to mature into this mature follicle, and it's almost ready to reach the area or day of ovulation. So that's going to happen on day 14. Ovulation typically in average is on day 14. Some females can be a little bit earlier, as in day 11 or 12, and other females can be a little bit later, as in day 15 or 16, right? Depending on their cycle. So that's why it's important to track the cycle so that you know when you are ovulating. On this day, you're going to notice an increase on LH, because LH is the one that stimulates ovulation for females to be pregnant. So that's going to happen on day 14, the day of the ovulation, right? The release of the egg. From after ovulation, from day 15, now we start getting into the post-ovulatory phase. And notice that at this time, the uterine lining, we call this area the secretory phase, because the stratum functionalis continues growing. It is going to be also stimulated by progesterone and estrogens, because if the female got pregnant, now notice that the egg has been, let's say that the egg was fertilized. Now that fertilized egg has to go implanted into the stratum functionalis, right? This is the stratum that is going to be implanted into. So progesterone and estrogens allows the uterus to receive that egg for implantation, correct implantation, and to grow the cells within the uterus, right? And so that progesterone and estrogen is going to come from the corpus luteum, which is the remaining of that follicle that was within the ovaries, right? So that corpus luteum is the one producing progesterone and estrogens, right? And so at the same time, the corpus luteum, remember, is going to be stimulated by LH. If there was no fertilization, right, that corpus luteum eventually becomes the corpus albicans, and the corpus albicans eventually disappears. And if there was no implantation of egg that was fertilized, then menstruation happens again. And so females start the cycle all over again. Lastly, on this video, I want to show you how the hormones fluctuate during the female reproductive cycle or the month. So you will see on this graph the hormone concentration in this case is increasing here, and these are the days at the bottom of this graph. We're going to start with FSH, right, or follicle stimulating hormone. Notice that follicle stimulating hormone during those days of the menstruation typically remains low in blood. Eventually, around days 11, it starts to increase in blood, and then it starts to decrease again around day 14, and then it remains very low in blood. Second hormone that we have to discuss is LH, or luteinizing hormone. Remember, those two hormones are coming from the pituitary. So notice how LH remains very low in blood for those first days of the cycle. And then eventually in day 10, notice there's going to be an increase on the hormone, and there's a spike here around day 14, right? 13 or 14, right? This is when ovulation happens. After that, notice how there's a decrease of the hormone in blood, and then it remains decreased throughout the rest of the cycle or days. Third hormone that we have to look at is estrogen and progesterone, right, as the fourth hormone. And that's why they are dashed, because they come from the ovaries, right? So estrogen, notice that it begins very low during those first days of menstruation. And then approximately on day 6 or day 8, it starts to increase. There's an increase in the estrogen levels in blood. And then notice that on day 12, approximately, there's a peak here. After day 12, there's going to be a decrease again of estrogen. And then around day 19 or 20, there's another small peak or increase in the concentration, but not as high as before ovulation. And from there, it decreases again down to day 28. And lastly, there is progesterone. Notice how progesterone remains very low in concentration, right, in blood, approximately right after ovulation. Right after ovulation, notice that progesterone starts to increase. And around day 22, it's at its highest peak. And then after that, progesterone starts decreasing, and then the cycle begins all over again. And if you want to see more about this information, click on the card on top of this video to check other videos that are very similar to this one. And that is it for today. Thank you so much for watching. Again, go ahead and subscribe, like, share, comment if you have any questions or suggestions. I read you guys. I always read you. Thank you for watching, and I'll see you on the next video.